It's February. Hooray! February is one of my favorite months. And one of the reasons it's one of my favorite months is because it's Heart Month. The American Heart Association designated February as American Heart Month 60 years ago. Yes, this is the 60th year we're focusing on heart health in February. And guess what? Heart disease is still the top killer. In fact, most years it's increased in the number of heart attacks and strokes and the number of deaths. Certainly, there's way more heart attacks, strokes, and deaths today than there were back in 1934 when the American Heart Association first designated February as Heart Month. So, I tell you all the time that heart disease is preventable, that heart attacks and strokes are avoidable, they're optional, so to speak, meaning there's so much we can do to protect ourselves. And I'm going to review that again today. And it is true. And we'll talk about why heart attack is still the top killer. If we have a month dedicated to it and we know what to do, we'll talk more about that later. But I want to say that I wore my red heart earrings for today. I'll probably wear them a lot this month, and I'll wear red a lot this month to increase our awareness of heart disease. And every time you see a red heart, or you think about Valentine's and you think about those you love, I want to think about your physical heart. This is my heart model, and the heart sits in the chest like this. This one is slightly larger than my heart because the heart is about the size of our fist, and this is slightly larger than my fist. But nonetheless, this is my heart model, and I want you to think about your loved one's actual heart muscle in their chest every time you see a Valentine, or you think about a Valentine type heart and your loved ones in the month of February and actually all year long. I'm going to put this back on the shelf where you can see it while I'm talking. That's where it normally sits. But I want to say that the American Heart Association has designated 8 essential things, 8 essential areas that if we focused on, the data shows us we can reduce our risk of heart attack and stroke both by 80%. Just 8 things and reduce our risk of having one of these devastating incidences, one of these devastating crises, if you will, by 80%. So what are these 8? So first of all, it's to eat better. We know that. Secondly, is to move more, be more active. Thirdly, is to quit smoking, of course. Fourthly, is to manage our weight. Fifthly, is to manage blood sugar. Sixth is to manage blood pressure. And 7th is to control cholesterol. You know that I believe that's too broad of a focus. We can't ignore cholesterol, but I have a lot to say about that. It's one of the essential 8, though, according to the American Heart Association. Yes, it cannot be ignored. It's not the topic for today's video. And then number 8, and that's a new one, actually. They added the 8th one, I believe, 2 years ago. Before that, it was 7 topics. And finally, the American Heart Association has rightfully added high-quality sleep to the essential 8. Why have they added high-quality sleep? Because we know that we need not only an adequate quantity or amount or length of time that we're asleep, we also need ideal oxygenation all night long. What does that mean? It means we need to breathe nice and slow and deep through our nose, inhaling high-quality oxygen all night long. That's another topic for another day, but I want to get back to the point that if we did these 8, we would prevent 80% of heart attacks and strokes, or reduce our risk by 80%. Isn't that amazing? So why is it that so many people still have a heart attack and still have a stroke? And why is it that the number of heart attacks and strokes keep going up every year and the number of deaths keep increasing? It's because, number one, we're not understanding the nuances about each of these 8. and we're not individualizing it for ourselves. And I believe that percentage. In fact, I know it's true because I see it in my practice and in my patients that 80% could go much higher to 90%, 95%, and greater if these last few things that I'm going to talk about were implemented in everyone's life as well. So we'll get to those in a minute. The next thing I want to say is that in February, the American Heart Association also brings to our awareness that heart disease is a women's disease as well as a man's disease. Both men and women equally die of heart disease. Women often have problems with heart disease or a heart attack or stroke about 5 to 10 years later in life than men. The average heart attack occurs for a man at 55 and women at 65. But women, did you know this, are more likely to die from their first heart attack than men are? More often, men will live long enough to have a second one, maybe even a third one. But nonetheless, women are affected by heart disease as much as men. It's incredibly common. So what are we to do about it? So number one, of course, these essential 8 in depth and a better understanding about yourself. Let's start with eat better. What type of diet you actually need. And secondly, are you getting enough exercise and the right type of exercise? Most importantly, maintaining and building muscle, but also just moving your body enough. We have specific ways to make that a doable project, if you will, in much less time and much more effective to protect your heart and give you the body that looks the way you want it to look. Quit tobacco, that's an entirely subject all of its own. Of course, all of us should stop inhaling alcohol. I'm sorry, let's not inhale alcohol. Should not inhale nicotine. And in fact, vaping now is in that category as well, regardless of what's in the vaping. So we all need to inhale high quality oxygen, not oxygen that has something in it, mixed in it, like nicotine or whatever is in vaping. And air pollution is in that category as well. Next, manage weight. Of course, maintain your healthy weight. And again, I'll say adequate muscle. It's more important what is the component of the weight. What makes up that weight on the scale is more important than what is that actual number, although the number is important, obviously. And then next, controlling cholesterol. As I said earlier, that's an entire video all of its own. It's a subject for another day, but we can't control cholesterol and a whole lot of other labs. Meaning, when I say cholesterol, I mean the lipid panel. Total cholesterol can have some implications, but we need the entire lipid panel. Next, manage blood sugar. Of course, that's another topic for another day as well. But in general, we want fasting blood sugar, 95 or lower. And we want our blood sugar to come back 1 hour after we eat any meal. 1 hour after any meal, we want our blood sugar to come back down to 125. Hopefully it didn't spike too high and comes back down to 125 at 1 hour and back down to 120 at 2 hours after a meal. And then next, control blood pressure. Yes, we like our blood pressure to be less than 118 on the top, the systolic number, and less than 80 on the bottom at all times. That's a challenging goal for a lot of people. And then lastly, of the essential 8 is high quality sleep. So not only sleeping for 6 to 8 hours, for some people it's 9, some people it's closer to 6, and then oxygenating well all night long, ensuring you get adequate sleep cycles, enough deep and REM sleep. So anyway, that's an overview of the essential 8. Again, implementing those 8 and understanding the nuances for you and understanding the details around all of those can reduce your risk of heart attack by 80%. But I want to say the piece that adds more power to these essential 8 is to get your testing to know exactly what's going on inside your body. Because then, rather than just thinking maybe on a daily basis or on a weekly basis or from time to time, how am I doing? Yeah, I'm exercising pretty good. How am I doing with my nutrition? Yeah, I'm eating pretty well. rather than stepping on the scale from time to time. In other words, in each category, we need to understand what's going on inside our body. It's easy to do with some simple tests. You've heard me talk about them in many videos, and I will talk about them again. But we also need to make the recommendations specific for our life and specific for what we find on our tests. So everyone needs to have a thorough, comprehensive evaluation and a personalized plan, and add that to the American Heart Association's Essential 8, and your risk of heart attack and stroke will drop like a rock, so to speak. We know you can protect yourself at the level of 80%, and I've seen that go up to 95% and higher in the lives of my patients. So remember, every time you see a Valentine's this February, every time you see a red heart and you think about your loved ones, I want you to think about your actual beating heart and the beating heart of your loved ones. And let's focus on protecting our hearts so that we have more Valentine's Day for many, many years to come, many, many years to celebrate with those we love the most. So happy February, everyone. Happy Valentine's Day that'll be coming up, and much more on this topic to come, as I'll be posting a lot more during the month of February because, hey, it's our month, American Heart Month.